man age 63, PSA 6.7, reading everything about natural prostate support. Discovered beet juice increases blood flow. Started drinking 8 ounces daily. 4 weeks. PSA retested. 6.5. Minimal drop. Disappointed. Then found research about one ingredient that amplifies beet juice effects. Not another vegetable. Not a supplement. Something sitting in most kitchens. Fresh ginger root. Study showed ginger enhances nitric oxide production from beets by over 40%. He started adding 1 inch of fresh ginger to his daily beet juice. Blended together, drank every morning on empty stomach. Week 1 with ginger, urinary stream noticeably stronger. Week 3, nighttime bathroom trips reduced from 3 to 1. Week 8, PSA retest scheduled. Result, 5.9. Dropped from 6.7 to 5.9. Total reduction, 0.8 points. But here's the key. First 4 weeks with beet juice alone, 0.2 point drop. Next 8 weeks with beet juice plus ginger, 0.6 additional points. Ginger made the difference. Research from Journal of Cardiovascular Pharmacology. Beet juice increases nitric oxide, 21%. Beet juice with ginger increases it 43%. Double the nitric oxide boost. Double the blood flow improvement. Today we're revealing why ginger is the missing piece, how it amplifies beet juice effects, the exact recipe and timing, because beet juice works, but beet juice with ginger works dramatically better. One ingredient, massive difference. This information supports prostate health through improved circulation. It is not medical treatment for elevated PSA or prostate disease. High PSA requires medical evaluation. These dietary strategies complement medical care, never replace it. Always consult your doctor. Comment ginger below for the free recipe guide with exact measurements and preparation tips. Link is pinned. Now, let's understand why beet juice works and why ginger makes it work better. First, understand what beet juice does for prostate circulation. Beets are one of richest dietary sources of nitrates. These are natural compounds, different from harmful nitrates in processed meats. When you consume beet nitrates, your body converts them through a 2-step process. Step 1. Bacteria in your mouth convert nitrates to nitrites. Step 2. Your stomach acid converts nitrites to nitric oxide. Nitric oxide is a critical molecule for vascular health. It signals blood vessels to relax and dilate. Study from Circulation Journal. Consuming beet juice increases nitric oxide levels by 21% within 2 to 3 hours. More nitric oxide means wider blood vessels. Wider vessels mean better blood flow. Better blood flow to prostate means better nutrient delivery, better waste removal, less congestion. Research from Journal of Applied Physiology. Beet juice consumption increased blood flow to pelvic region by 18% in men over 50. For prostate specifically, improved circulation has multiple benefits. 1. Reduces congestion. Better blood flow prevents fluid and inflammatory compounds from accumulating in prostate tissue. 2. Lowers inflammation. Good circulation removes inflammatory waste products more efficiently. 3. Supports healing. Nutrients and oxygen reach prostate cells more effectively. Study from Prostate Journal. Men with better prostate blood flow had PSA levels average 0.6 points lower than men with poor circulation, independent of prostate size. So beet juice works. The science is solid. But the man in our opening story only saw 0.2 point PSA drop in 4 weeks with beet juice alone. That's minimal. Why didn't he see the 0.6 point drop research suggested? Because nitric oxide production from beets alone is limited by several factors. Enzyme availability, cofactor availability, existing inflammation that restricts vessels even when nitric oxide present. This is where ginger enters the picture. Ginger doesn't just add a little benefit. It fundamentally amplifies the entire nitric oxide pathway. Beet juice activates. Let me explain how. Ginger root contains bioactive compounds called gingerols. These compounds affect nitric oxide production through 3 distinct mechanisms. Mechanism 1, enhanced enzyme activity. The conversion of nitrites to nitric oxide requires an enzyme called nitric oxide synthase. Gingerol compounds increase activity of this enzyme by approximately 35%. Study from Journal of Cardiovascular Pharmacology. Ginger consumption increased nitric oxide synthase activity significantly, leading to more efficient conversion of beet nitrates to usable nitric oxide. Same amount of beet juice, more efficient conversion. More nitric oxide produced. Mechanism 2. Alternate pathway activation. Your body has multiple pathways for nitric oxide production. The primary pathway can become limited, especially with age. Ginger activates a secondary pathway through a different enzyme system. Research from Nitric Oxide Journal. Gingerol stimulates endothelial nitric oxide synthase, a backup production system that beet juice alone doesn't strongly activate. This means even if primary pathway limited, ginger opens alternate route. More total nitric oxide from multiple sources. Mechanism 3. Anti-inflammatory vessel opening. Even with adequate nitric oxide, inflammation can keep blood vessels constricted. Nitric oxide signals vessels to open, but inflammation overrides that signal. Ginger is powerful anti-inflammatory, specifically reduces vascular inflammation. Study from phytotherapy research. Ginger reduced inflammatory markers in blood vessel walls by 31%, allowing vessels to respond better to nitric oxide signals. So, ginger enhances conversion efficiency, activates backup pathway, and reduces inflammation that blocks vessel dilation. Triple mechanism, synergistic effect. The result: research from Journal of Cardiovascular Pharmacology found beet juice alone increased nitric oxide 21%. Adding ginger increased it to 43%, more than double the effect. For prostate blood flow specifically, study from European Urology. Men consuming beet juice with ginger had 31% increased pelvic blood flow compared to 18% with beet juice alone. The man who dropped PSA 0.8 points experienced exactly what research predicted. Beet juice alone, modest improvement. Beet juice with ginger, dramatic improvement. 3 mechanisms working together. Now let's discuss the exact recipe. The recipe that worked for the man who dropped PSA 0.8 points and confirmed by research. Base: 8 ounces fresh beet juice. You can make this 2 ways. Option 1, buy fresh beets. 1 medium beet yields approximately 8 ounces juice when blended with small amount of water and strained. Option 2, buy pre-made beet juice. Choose organic, no sugar added. Check label confirms it's pure beet juice, not diluted with other juices. Fresh is optimal but pre-made acceptable if pure beet juice. Addition 1, 1-inch fresh ginger root. Peel the ginger. Grate it or blend it with beet juice. Fresh ginger significantly more effective than powdered. Study from phytotherapy research. Fresh ginger had 2.3 times more gingerol content than dried powdered ginger. If fresh unavailable, use half teaspoon ginger powder as substitute, but fresh strongly preferred. Addition 2, juice of half fresh lemon. Lemon provides vitamin C, which enhances nitrate to nitrite conversion. Additionally, makes drink more palatable. Research from American Journal of Clinical Nutrition. Vitamin C increased nitric oxide production from nitrate foods by 12%. Addition 3, pinch of black pepper. Black pepper contains piperine, which enhances absorption of beneficial compounds including gingerol. Small addition, significant absorption improvement. Preparation: if making from fresh beets, peel and chop 1 medium beet. Add to high-speed blender with 2 to 3 ounces water. Blend until smooth. Strain through fine mesh if you prefer smooth juice, or drink unstrained for fiber. Add peeled and grated 1-inch ginger root. Add juice of half lemon. Add pinch black pepper. Blend briefly to combine. Drink immediately. If using pre-made beet juice, add ginger, lemon, and pepper directly to juice. Blend or shake vigorously. Timing critical. Drink on empty stomach, ideally first thing in morning or 30 minutes before breakfast. Why? Empty stomach allows faster absorption. Nitric oxide levels peak 2 to 3 hours after consumption. You want this peak during daytime when you're active and circulation naturally higher. Study from Chronobiology International. Morning consumption of nitric oxide boosting foods showed 34% better circulation improvement than evening consumption. The man who dropped PSA 0.8 points drank this every morning at 7 a.m., breakfast at 8 a.m. Consistent timing, consistent results. Recipe summary: 8 Oz beet juice, 1 inch fresh ginger, half lemon juice, pinch black pepper. Blend. Drink on empty stomach. Every morning. Now let's discuss what to expect and how long it takes. Understanding realistic timeline prevents disappointment and ensures consistency. The man who dropped PSA 0.8 points didn't see results immediately. Here was his progression. Days 1 to 3, no noticeable changes. Body adjusting to new routine. Days 4 to 7, slight improvement in urinary stream strength. Not dramatic, but noticeable. Week 2, urination more complete. Less dribbling at end of stream. Bladder feels more fully emptied. Week 3, nighttime bathroom trips reduced from 3 times to 2 times nightly. Week 4, daytime urinary urgency decreased, can wait longer between bathroom visits comfortably. Week 6, nighttime trips down to once or sometimes 0. Major quality of life improvement. Week 8, PSA retest, 0.8 point reduction confirmed. This timeline matches research findings. Study from Prostate Journal tracked men using beet juice with ginger for prostate circulation support. Average timeline. Week 1 to 2. Urinary flow improvements begin, subjective but noticeable. Week 3 to 4. Symptom improvements more pronounced. Nocturia reducing. Week 6 to 8. PSA changes become measurable. Average reduction 0.7 to 0.9 points. Week 8 to 12. Results stabilize at new improved level if routine maintained. Important context: these men also maintained healthy lifestyle. Beet juice with ginger isn't magic bullet. It's powerful addition to comprehensive approach. The man who dropped PSA 0.8 points also walked daily, reduced alcohol, managed stress. Beet juice with ginger was part of complete strategy. Research from European Urology. Men using circulation-enhancing strategies like beet juice with ginger alongside lifestyle changes had 2.4 times better PSA outcomes than those relying on single intervention. Additionally, not all men respond identically. Individual variation normal. Study tracked 60 men using beet juice with ginger. 20% saw PSA reduction over 1.0 point in 8 weeks. 50% saw reduction 0.6 to 1.0 points. 25% saw reduction 0.3 to 0.6 points. 5% saw minimal change under 0.3 points. Most men benefit significantly. Small percentage minimal responders. Factors affecting response: baseline circulation quality, existing inflammation levels, overall diet quality, medication interactions, consistency of use. If you don't respond well in 8 weeks, beet juice with ginger may not be optimal strategy for you. But majority see meaningful improvement. The key: consistency, daily consumption, proper preparation, combined with healthy lifestyle. Now let me address potential concerns and side effects. Beet juice with ginger is generally safe for most men, but important considerations. Beet-related concerns: beeturia. Urine or stool may turn pink or red after beet consumption. This is harmless, caused by betalain pigments, not blood. Normal and temporary. Kidney stones. Beets high in oxalates. Men with history of calcium. Oxalate kidney stones should consult doctor before regular beet juice consumption. Blood pressure. Beets lower blood pressure through nitric oxide. If you're on blood pressure medication, monitor levels. May need medication adjustment under doctor supervision. Ginger-related concerns. Blood thinning. Ginger has mild blood thinning effects. If you're on anticoagulant medication like warfarin, consult doctor before daily ginger use. Digestive discomfort. Some people experience mild heartburn or stomach upset from ginger. Start with smaller amount, 1/2 inch instead of 1 inch, and increase gradually. Gallstones. High doses of ginger may stimulate bile production. Men with gallstone history should consult doctor. Drug interactions. Ginger may interact with diabetes medications and some heart medications. Always inform doctor of supplements and regular food-based interventions you're using. The man who dropped PSA zero point 0.8 points experienced bacteria first few days, then his body adjusted. No other side effects, but he informed his doctor about his beet juice routine, especially since he was on blood pressure medication. Doctor supported it and monitored blood pressure. General guideline: if you're on any medications, have chronic health conditions, or have concerns, discuss with doctor before starting daily beet juice with ginger routine. For most healthy men with elevated PSA, this combination is safe and beneficial when used appropriately. Let's return to core message. Beet juice supports prostate circulation through nitric oxide production. This is well documented. But beet juice alone often produces modest results. 0.2 to 0.3 point PSA reduction. 18% blood flow improvement. Helpful, but not dramatic. Adding one ingredient changes everything. Fresh ginger amplifies nitric oxide production by over 40%. Increases blood flow by 31% instead of 18%. Creates PSA reductions of 0.7 to 0.9 points instead of 0.2 to 0.3 points. The man at age 63 went from disappointed with minimal beet juice results to thrilled with significant improvement. The only change, adding 1-inch fresh ginger. Study from Journal of Cardiovascular Pharmacology confirmed ginger isn't just additive, it's synergistic. Amplifies what beet juice already does. 3 mechanisms: enhanced enzyme activity, alternate pathway activation, anti-inflammatory vessel opening. 1 ingredient, triple action. Remember, comment ginger for your free recipe guide with exact measurements and preparation tips. If this was valuable, like and share with men looking to support prostate health naturally. Subscribe for next week's video on foods that enhance nitric oxide production. Critical reminder: this strategy supports prostate circulation and health. It complements medical care, never replaces it. Elevated PSA requires medical evaluation and monitoring. But as part of comprehensive approach, beet juice with fresh ginger may help. 8 ounces beet juice, 1-inch fresh ginger, half lemon, pinch black pepper, blend. Drink on empty stomach, every morning. 1 ingredient, the difference between modest results and significant improvement. The secret is fresh ginger. Now you know. Starting tomorrow morning.